If you wake up at night because your feet are burning, if your fingers feel numb for no reason anyone can explain, or if you've been told that's just part of getting older and something inside you refuses to accept that answer, stay with me. What I'm about to tell you in the next few minutes could be the most important thing you hear this year, because the real cause of nerve damage after 60 is not what most doctors talk about, and the window to do something about it is smaller than most people realize. By the end of this video, you will understand exactly what is attacking your nerves right now, why most seniors never see it coming, and 5 concrete steps that can stop the damage before it becomes permanent. Not manage it, stop it. My name is Dr. Gregory Holt. I've been working in senior health for over 15 years, specializing in metabolic function and nerve health in adults over 60. I've seen thousands of patients told there was nothing they could do, patients who went on to make real, measurable improvements once they understood what was actually going on inside their bodies. Before we go any further, I want to be clear about something important. Everything I share in this video is educational. It is not a substitute for professional medical advice. If you're experiencing tingling, numbness, burning, or pain in your hands or feet, please see a licensed medical professional. Your nerves deserve that level of care. What I'm giving you today is the knowledge to ask better questions and make smarter decisions. Now, let's talk about what's really happening. Here's the first thing you need to understand, and most people have never heard this explained clearly. Your nerves are not like electrical cables. They are living tissue. They need oxygen, specific nutrients, and stable chemistry to work. And unlike your skin, which can heal a cut in days, a damaged nerve can take months or years to recover, if it recovers at all. That's the biological reality most doctors don't spend enough time explaining. And here's where it gets serious. Nerve damage does not start the day you feel pain. It starts years before, silently, accumulating in the background while life goes on normally. By the time you feel tingling in your toes or burning in the soles of your feet at night, the process has often been running for a long time. Think of it like a slow leak in a pipe. You don't see the water damage on your ceiling on day one. By the time you notice it, the damage behind the wall is already significant. That's what nerve deterioration looks like from the inside, which leads to the question I want you to hold on to right now. If this damage builds for years before symptoms appear, what is causing it? And is it already happening to you? Let me tell you about a patient I'll call Richard. 71 years old, former school teacher, still sharp, still active. He came to see me not because of pain, but because of a strange feeling, like he was walking on thick socks even though his feet were bare. His balance had become slightly unreliable on stairs. His primary care doctor had told him it was probably circulation issues related to age. When I dug into Richard's full picture, his diet, his medications, his blood work, I found something different, something that his previous doctors hadn't connected to his nerve symptoms. And when we addressed it directly, the progression stopped. He didn't fully reverse years of quiet damage overnight, but the slide stopped, and that changed the trajectory of the next 10 years of his life. What did we find? I'll tell you in a moment. But first, I need to give you the framework to understand it properly. The single most destructive force attacking senior nerves today is not a virus, not aging itself, and not genetics. It is chronic blood sugar toxicity. And here is the part most people miss completely. You do not need a diabetes diagnosis for this to be destroying your nerves right now. You only need repeated blood sugar spikes, and the majority of adults over 60 experience those spikes every single day, completely unaware. Here's how it works. When blood sugar rises too high, sugar molecules begin to attach to nerve fibers and to the microscopic blood vessels that deliver oxygen to those nerves. This process, called glycation, creates inflammation and oxidative stress. It damages the protective coating around nerve fibers, called myelin. Without healthy myelin, nerves can't send clean signals. The result? Tingling, numbness, burning, electric pain, loss of sensation, loss of balance. And the reason so many seniors are caught off guard is this. Prediabetes, which affects an enormous portion of adults over 60, causes nerve damage at nearly the same rate as full diabetes. The difference is that most people with prediabetes don't know they have it. Their doctor may have mentioned that blood sugar was a little elevated or something to watch. That phrase, something to watch, has cost a lot of people years of nerve health. I want to stop here and ask you directly. Have you ever been told your blood sugar was borderline or that you were pre-diabetic? Write your answer in the comments, because awareness is the beginning of protection, and this is exactly where I want you to stay focused, because the next point is where things start to click into place. So, where does the blood sugar toxicity actually come from? That's what most people get wrong, because it hides in places that look completely healthy. The first major source is liquid sugar. Fruit juice, sweetened coffee, energy drinks, sports drinks, and yes, even so-called healthy smoothies. Liquid sugar enters your bloodstream with extraordinary speed because there is no fiber to slow it down. The result is a spike that hits nerve tissue hard and fast. I had a patient named Margaret, 68 years old, retired nurse. She was meticulous about her health. Every morning she made a smoothie, fresh fruit, a splash of juice, some yogurt. She thought she was doing everything right. When we mapped her blood sugar response after that smoothie, the spike was dramatic. Her nerves were absorbing a chemical shock before 8 a.m. every single day. Once we replaced the smoothie with a protein-based breakfast and moved fruit to a small portion after lunch, eaten with food, not alone, her nighttime burning reduced significantly within 3 weeks. Nothing dramatic, no medication changes. We simply stopped the daily nerve assault. The second major source is refined carbohydrates eaten in isolation. Bread, crackers, cereal, white rice, pasta. These aren't inherently evil foods, but when eaten alone, without protein or fat, they break down into sugar rapidly. Seniors are often advised to eat light and easy to digest foods. Unfortunately, easy to digest very often means fast sugar release. And fast sugar release means nerve exposure to toxic levels repeatedly throughout the day. Here's the rule that changes everything, and I want you to remember this. Never eat carbohydrates alone. Not fruit, not toast, not crackers. When a carbohydrate is paired with protein or healthy fat, absorption slows dramatically. The sugar enters the bloodstream gradually, without the sharp spike. The same food that harms your nerves when eaten alone becomes significantly safer when eaten correctly. That's not a supplement. That's not a procedure. That's a fork and plate decision that you can make starting at your next meal. The third major source, and this one surprises most people, constant snacking. Grazing throughout the day keeps insulin elevated all day long. There is never a recovery window. Nerves need stability to repair. Constant sugar exposure keeps them inflamed and unable to rest. The habit of nibbling between meals, even on foods that seem harmless, can maintain a chronic inflammatory state that silently accelerates nerve damage. Now here's something most people never hear, and it's critical if you're over 60. Certain common medications quietly worsen nerve damage by depleting the nutrients your nerves depend on to survive. Acid-reducing medications, widely used by seniors for reflux and heartburn, can significantly reduce the absorption of vitamin B12 over time. Some common diabetes medications have been associated with B12 depletion as well. And certain cholesterol-lowering drugs may affect how efficiently cells use coenzyme Q10, which plays a role in nerve energy production. B12 is not a minor nutrient. It is essential for maintaining the myelin sheath, the protective coating around your nerve fibers. Without adequate B12, nerves become exposed and fragile. They misfire. They send distorted signals. They become increasingly vulnerable to the blood sugar toxicity I described earlier. I once treated a woman, mid-70s, who had been experiencing worsening numbness in both feet for 3 years. She had been told repeatedly it was age-related neuropathy. When I ran a full nutrient panel, her B12 was critically low. The culprit wasn't her diet. It was a medication she had taken faithfully for years, a medication she had never been told could affect her nerve health. Once we corrected the deficiency, carefully, under supervision, her nerve symptoms stabilized. The progression stopped. If you take any long-term medication and you've never had your B12 levels tested, that is a conversation worth having with your doctor. Not because I'm telling you to stop your medication, never change medications without guidance, but because knowing your levels gives you the information to protect yourself. B12 is not the only nutrient your nerves depend on. Magnesium supports nerve signaling and reduces the cramping and twitching that many seniors experience at night. Folate works alongside B12 to protect nerve tissue from deterioration. Alpha-lipoic acid, an antioxidant, has been shown in clinical research to reduce oxidative stress in nerve tissue and improve neuropathy symptoms in some patients. These aren't magic supplements, and more is absolutely not better. Certain nutrients, like B6 in high doses, can actually damage nerves if misused. The goal is to identify what you may be deficient in and address that specifically. Guessing can cause harm. Testing gives you the truth. Let's talk about the thing that ties all of this together. Inflammation. Because inflammation is what turns a manageable nerve problem into an unbearable one. Chronic inflammation sensitizes nerve endings. It amplifies pain signals that might otherwise be mild. It is the reason some seniors with moderate nerve damage experience severe burning and stabbing pain, while others with similar damage experience only numbness. Inflammation is the volume dial on nerve pain, and certain foods turn that dial all the way up. Highly processed foods, refined vegetable oils, excessive sugar, and ultra-processed snacks all fuel the inflammatory cascade that makes nerves scream. On the other side, foods like fatty fish, salmon, mackerel, sardines, extra virgin olive oil, leafy green vegetables, and spices like turmeric actively calm inflammatory pathways. Less inflammation means quieter nerves. That's not a theory, that's well-established biology. And there is one more tool that is available to every single person watching this right now for free. Movement. Gentle, consistent movement after meals, even a 10-minute walk, has a measurable effect on blood sugar and blood flow to nerve tissue. You do not need to run, you do not need a gym, you need to move. Blood flow is what delivers oxygen to nerves. Nerves without oxygen deteriorate. Nerves with steady circulation have a fighting chance. I want to say something directly because I think it matters. The most dangerous thing anyone tells a senior with nerve damage is that nothing can be done. I have heard that sentence send people into a kind of hopeless stillness, where they stop trying, the poison keeps working, and the damage accelerates. That sentence is wrong. Is nerve damage always fully reversible? No, I will not tell you that. But is it always stoppable from getting worse? In many cases, yes. And stopping the progression is not a consolation prize, it is a life-changing outcome. Less pain at night means better sleep means clearer thinking and more energy. Steadier balance means more confidence on your feet, more confidence means more independence means more life. The chain of consequences runs in both directions, and the direction you're heading right now is a choice. Let me bring this together quickly before we close. The single worst poison destroying senior nerves is chronic blood sugar toxicity. And you don't need diabetes for it to be happening to you. It hides in liquid sugar, refined carbohydrates eaten alone, and constant snacking. Certain common medications quietly deplete the B vitamins your nerves need to survive. Key nutrients, B12, magnesium, folate, alpha-lipoic acid, support nerve stability and protection. Chronic inflammation amplifies pain and must be calmed through food and movement. And gentle daily movement after meals improves circulation and blood sugar simultaneously. Here's your starting point for the next 2 to 4 weeks. Remove liquid sugar entirely. No juice, no sweetened drinks. Pair every carbohydrate you eat with a protein or a healthy fat. Never eat fruit on an empty stomach, always after a meal. Walk for 10 minutes after eating when you can. Ask your doctor to test your B12 levels, especially if you take long-term medications, and pay attention to what changes. Many people notice reduced burning at night within weeks. That's not a miracle. That's your body responding to the removal of a daily poison. If this video gave you something valuable, a new angle, a piece of knowledge you didn't have before, consider subscribing. We publish practical, honest health information for adults over 60 every week. No hype, no false promises, just the real picture so you can make real decisions. Your nerves are worth protecting, and the time to start is not someday, it's now.